Sanibonani babugeli emakhaya siyanibingelela on holistic healthy living. Siyabonga ukuthi today sikhonile ukuthi sihlangane. And we are actually having one of those shows lapho nizokhona ukuthi nisifonele niqhumane nathi bese ke niyabuza imibuzo. Ngiyamthemba ukuthi abaningi bayazibuza ukuthi wow, I wonder ukuthi yini lena esikhuluma ngayo namhlanje. Well, indeed, before singena kulo indaba yanamhlanje, I must just say ukuthi siyabonga ukuthi siyabukela kanti futhi siyafunda kabanzi ngezempilo. Uhlelo lwethu esiluthanda kakhulu kanti ke futhi sifuna nokubonga the bishop and the lady bishop of this house for giving us this opportunity ukuthi sikhone ukuthi sifundisaneni ngezempilo. So today we are actually going to start a topic ukuthi ke it is breast cancer. Indeed, it is the month of October, and siyazi ke ukuthi usually from the month of October there is breast cancer awareness. Konke lapho esiyakhona, we are just talking about breast cancer. And so today we actually want to start this topic. Lapho sizofundisana nje ukuthi kahle kahle iyini i-breast cancer and why is it important. And so I hope ukuthi sonke siyabona lapho on the screens, and I will explain as we go. So firstly, kubalulekile ukuthi sizwisise ukuthi i-cancer yona iyini. And well, cancer basically it is a broad term that basically it means it's a class of diseases, all right, that are characterized by abnormal cells that grow and invade healthy cells in the body. And what that basically means is usually you have cells are right, akhula kahle, and then ngesikhathi kumele ukuthi ke afe, and then they get eliminated from the body. And now once leyo process ingasahambi ngaleyo ndlela ukuthi cells angasekho right ayafa bese ayaphuma emzimbeni. So what happens is now in cancer these cells don't die, instead ziloko ziyakhula. And so bese kuzoyenzeka what will then happen is that kuzoba nama-cells amaningi agulayo angasi right, and then amanye nje akhula like at a very rapid rate until they just basically grow. And then that's where umuntu uzoza ngathi una what we call a lump, isigaqa, and so that is one of the ways. Akusho ukuthi isigaqa siyi-cancer, but one of the ways or what usually then happens, ama-cells mawaloku akhula then kuba nesigaqa. So that is just basically cancer. All right, and now breast cancer is when this whole process ngi-explainile iyenzeka kuphi ebeleni. All right, iyenzeka ebeleni, and from there angano ukuthi aphelele lapho at the breast itself, or lama cells lawa agulayo lawa ngekho right angaspreada aye kwezinye amanye ama-organs in the body. And once that happens, we call it metastases. Kusho ukuthi i-cancer leyo ayisekho kuphela ebeleni kodwa seyihambile yaspreada yaya kwamanye ama-organ wasemzimbeni. And that is just basically the definition of breast cancer. Now, the next thing that we want to know is, okay, now we know what is cancer. Now we know what is breast cancer. Now, the most important thing that we want to know is what are the causes of breast cancer. And this, babugeli emakhaya, is a question that we get a lot. Ukuthi, okay, yini kahle kahle into ekhosayo breast cancer? And well, I have to say this, we do not know what is the exact cause of breast cancer. And ngizo explain ukuthi what do I mean. Asazi ukuthi kahle kahle singathi nje yilento le ekhoza breast cancer. Why? Because we find ukuthi kunezinto eziningi. There are environmental factors. There are environmental factors as well as genetic factors. Zonke ziya contributor. So we can't say ukuthi it is just this particular thing causes cancer. So we do not know. However, what we do know is there is definitely damaged DNA cells. So there is a damage to the cells in the DNA, and that is why one then ends up developing what we then call a cancer, and in this case, particularly breast cancer. So we do not know the causes of breast cancer. However, we have identified risk factors. So ngiyacala nje ukuthi singa confuse ama cause nama risk factor. Sikhumbule ukuthi sithize ama cause ukuthi into eyenza ukuthi umuntu abe ne breast cancer asikwazi lokho. Medically speaking, we do not have that information. We do not know, but what we do know is there is a damage in the cells that are in your DNA. But what we also do know is there are risk factors. And risk factors yizinto ezisitshela ukuthi, you know, zisitshela the likelihood ukuthi umuntu angaba ne breast cancer. Akusho ukuthi ma unalawo ma risk factor kusho ukuthi na kanjani uzoba ne breast cancer. No. But what it means is that if siyawathola lawo ma risk factor kuwe, it simply means wena nasithatha wena onama risk factor, sithatha omunye onganawo ama risk factor. Ama chance wokuthi lo onawo ama risk factor ayithole icancer aphezulu. They are higher than the one that does not necessarily have the risk factors. So risk factors doesn't mean you're going to get the cancer. No. It means ukuthi ama chance wokuthi uthole le cancer kulo onama risk factor, they are higher. Now we're going to actually talk about together different kinds of risk factors. And ngiyathanda ukuthi lana sizowahlukanisa ama risk factor. We have what we call your genetic risk factors, or risk factors that there is nothing that you can do about it. Ayikho into ongayichange like anjalo, ayikho into ongayenza ukuthi change lawo ama risk factor. And then we have environmental risk factors, or modifiable risk factors. Modifiable risk factors means, well, kusekhona okuncane ongakwenza ngalawo ma risk factor. So let's start with these genetic risk factors, or these risk factors that really there is nothing much that you can do about it. And the first one is gender. Obviously, we know ukuthi breast cancer is 100 times more common or more often in abantu besifazane versus abantu besilisa. Now that is very important because omunye umuntu uyazibuza ukuthi hawu, so nabantu besilisa bangayithola breast cancer. Yes, nabantu besilisa can actually get breast cancer. Why? Because both male and female have what we call breast tissue. Okay, remember, breast cancer is when you have these abnormal cell growth, ilomdlavuza ukude breast tissue, and both male and female actually have breast tissue. So yes, it is possible ukuthi abantu besilisa bangaba nayo breast cancer. So that being said, kubalekile ukuthi ngisho kuba ababukeli emakhaya ukuthi this topic, as much as it is very, very important for the females, it is also important for males to take note ukuthi there is such a thing or a phenomenon as male breast cancer. Good. So that was gender. Next thing is the age. So yes, ngempela, the more one grows older, you know, the chances are higher. In fact, 2 out of 3 women, you know, that get an invasive type of cancer, it's usually after the age of 55. But again, that being said, it does not mean that if you are younger than 55, if you are in your 20s or your 30s, you cannot get breast cancer. That is not the case. Anyone, in fact, can get breast cancer. So we spoke about each gender, females more than in males. Good. Next, we said it's the age, kakhulu esebakhulile, especially after 55. Right. Next thing is the race. You know, usually it is more common in Caucasian women. That it is more common versus your black. All right, does that mean black people don't get it? No, absolutely not. Good. Now the next thing is family history. So when we're talking about family history, kakhulu futhi we like to say particularly first degree relatives, and those are abantu ngempela. It could be your mom or your sisters, abantu that are very close. Those are usually your first degree relatives. So if you have a family history, mhlambe egini kune breast cancer, kunomuntu obekane breast cancer, that means amachance wakho ukuthi uthole i-breast cancer, they are higher than umuntu egibo ekungana breast cancer. Does it mean ukuthi you will definitely get breast cancer? No. If your mom, I send an example, if your mom has breast cancer and here you come, does it mean that now you will definitely have breast cancer? No. But it means that your chances of getting it are higher. All right, now we're moving on, a personal history. You know, personal history, that means if you, for example, have been diagnosed, you know, with breast cancer, asithi mhlambe ebeleni laga left, ne? Asithi when you've been diagnosed with cancer ebeleni laga left, your chances of getting breast cancer ebeleni laga right are even higher. You know, it happens. It is definitely more common. Good. Now we are moving on. Menstrual and reproductive history. Now, early menstruation, meaning before the age of 10 or 12, as well as late menopause, that is abantu that's abayego menopause after the age of 55. Those people have a higher risk. So if you've had your period earlier, okay, before the age of 12, or you went into menopause late after 55, your chances of getting breast cancer, they are slightly higher. It is a risk factor. Good. And also some genetics that play a role. Mostly we usually find there's some abnormality in what we call the BRCA genes. But basically, you know, if there's a mutation in that gene, you know, chances of getting breast cancer are also higher. Why are we saying that? Because we've seen most of abantu that have breast cancer, when we check at their genome, we usually find these genes and they are usually positive. If they are found to be mutated, they can also help us in terms of a treatment. But loko sizongena Google later. So the purpose here ukuthi si understand gabanzi ama risk factors. Okay, asifuna ukuthi sijahe this topic of breast cancer because it affects each and every single one of us. And even if it means ukuthi we must stretch this topic and singayiqedi namhlanje, then so be it. But the aim, the purpose ukuthi ingene sizwisise. I want ukuthi masiqeda la, you must really know the ins and outs, or the things that are very necessary for you to know about breast cancer. Now, one of the last risk factors is dense breast tissue. You know, it's dense, it's thick, you know, and usually those kind of breasts, it's difficult to guti uzwe ilamp, and so it can often go unnoticed or it can be missed, and then later it is found. All right, so those are the risk factors that really there's nothing you can do about it. You can't, there's really nothing much you can do about your age, you know, nothing you can do about your gender, nothing you can do about your race, those kind of things. So that's why I said initially we have those risk factors that they're not modifiable. There's really nothing much that you can do about them. Now we're moving on to the more environmental type of risk factors, or rather the risk factors, the modifiable ones. And the first one is lack of physical activity. And that simply means umuntu that has a sedentary lifestyle. What does that mean? Umuntu ongazivocavoci, umuntu ongekho physically active. All right, and by physically active akusho ukuthi uyavuka, uyahamba emsebenzini, uyabuya, or mhlambe endlini uyaklina, uyabuya. No, but you need to have some form of exercise. Kungabi ukuthi you are what we usually call a couch potato, or you know, you're forever lying in your bed. Sedentary lifestyle, umuntu ongazivocavoci nje that is not good, you know. And so this is something you can actually change. If you do not exercise, if nakona you're just like, oh, okay, but where do I start? Show yaga coach, please. If you're on social media, you can just go back to the shows, because that's why they are there. That is why they are on social media, so that if you need to go back, you can always go back and check it out. So please, it is very, very important. Now, Babugeli, before we continue, I just need to let you know, please, we will definitely be opening the lines, and I'm just going to give you the number to call us if you have any questions. If there's anything that is not clear, please call us and let us know what is your question, and we'll be able to answer your question. The number ending as Tolaguyo, it is 01202305559. Sisengakawavuli ke ama lines wethu, but as soon as they are open, we will let you know. It's just for you ukuthi ube ready. If your airtiming is ready, get your airtime. If you still need to get your things sorted out, please do. You're still not sure of your question, get all of that sorted out. The number that you will use to call us is 01202305559. Now, for those about to join us, we are talking about breast cancer. It is the month of October, and we're doing breast cancer awareness. And what we were then talking about are the risk factors of a breast cancer. And we also explained that risk factors does not necessarily mean you will get the breast cancer, but it simply means your chances or your likelihood of getting breast cancer are higher than one that does not have them. And we are talking about the environmental risk factors, which are the ones that are really modifiable. And so we spoke about the lack of activity, and now we are getting into a poor diet. Now, what does that mean? Kakulu, we're talking about the food. We're talking about the food that we eat, and we're saying, there's good food, there's bad food, exactly what is what. And a poor diet is one of them. And this is a diet that is high in fat, amafuta. They're very nice, but they are not good for your body. Too much of anything, in fact, is not good for your body. So a diet that is high in fat, it doesn't have ama fruits, it doesn't have ama veggie, it increases your risk of getting breast cancer. So mbugeli emakaya, if fruits, please change that. Yes, both women and men alike. Now, the next risk factor is being overweight or obese. And Gakulu, this term, overweight, obese, sometimes say we don't really understand it. Basically, what we usually like to measure it, and we use what we call the BMI to measure. So umuntu kahle kahle ufola ngakuphi. Are you underweight? Are you in the normal weight? Are you overweight? Are you obese? And we do not want overweight or obese. The nice thing about this is, no, you do not need to see a doctor to know whether or not you are overweight or you are obese. You can actually do it yourself at home. Okay, doctor, how do I do that? Well, what you do need is scale, la ukibela khona, and then iyakutshela ukuthi uya kanganani. Asithi ke sewugibelile, you need to get that value ukuthi uya kanganani. Please, ukuthi ningaziphathisa inhliziyo, and to get an accurate reading, it is better if you take it in the morning while you are naked, all right? If you're wearing jackets, that may increase the number, so try not to do that. Good. So that is your weight. Then you need to measure your height. Ukuthi umude kangakanani. All right. And thereafter, I will share with you the calculation that you will need to do to determine BMI. And basically, it has to always be your weight over your height in meters squared. Then you will get a number. And usually, if you are over 30, you are overweight. And if you are over, once so reach about 35 to 40, we say you are obese. That was just kancane nje, ne? Okay, cool. And if you need more information, please write on your social media. We will answer all of the questions. If there's anything that is not clear, we will answer that. So being overweight, being obese, it is a problem. Now, the next risk factor is drinking alcohol. If you drink, omunye mhlambe la khona uthi, oh, marabathizena nawuphuza i-red wine glass a day, it is fine, it is good for my heart. Okay, asiphikisi ke futhi lokho. What we are saying, however, is that if you are drinking alcohol frequently, that becomes a problem. That is a risk factor. So if uphuza utshwala and uphuza a lot of amounts and you drink it, you know, a lot of times in a week, that is a risk factor. Good. And then nextly is if you are exposed to radiation in the chest, and this usually, and this is if it's before the age of 30. Radiation, you get it a lot as a form of therapy, or maybe there are tests that are being done, and then, you know, doctors expose you to the radiation. So if you're exposed to too much radiation before the age of 30 on the chest, that may increase, that is a risk factor rather for breast cancer. And last but not least, combined hormonal replacement therapy. And this is when you're either taking this hormone therapy, it could be for menopause. This can also be a risk factor for breast cancer. Now, Babugeli, we have gone through the genetic risk factors, and we also went through the environmental risk factors that predispose or that increases your chance of getting breast cancer. But we did say, this does not mean that when you have these risk factors, you will get breast cancer. What it means is that ama chance wako to get this breast cancer are higher. And so, good the risk factors allow that you can modify your diet, the physical activity, you know, we spoke about the sedentary lifestyle. We spoke about, you know, increased fat that you are eating, the alcohol, the things that you can do something about. Please, 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 asenzeni ukuthi sikuchange lokho. Mawungadli kahle idla kahle. Add your vegetables, add your fruits, reduce fat. It is quite also important to mention even smoking increases. Smoking is just bad, and it is a risk factor for almost anything. And if you also do that, please do not do it. Why? It is a risk factor for breast cancer. All right. Now that we know, you know, we don't really have an exact cause of what causes breast cancer, but we have risk factors. And it says, okay, yimapi ama risk factor. I'm sure you're boutique. Okay, yes, no, yes, no. That is very good, because that gives you an idea of, okay, do I have a lot of risk factors? Don't I have a lot of risk factors? What is the likelihood of me getting it versus me not getting a breast cancer? Now, we're going to actually move on. So I just need to mention this, and we will also mention it later. Izinto that we know they do not cause breast cancer. One, we need to know that if breast cancer is not contagious. What does that mean? If kunomuntu la one breast cancer and then uhlelelana or whatever isemoyeni, no, it's unlike other diseases that are actually contagious, that can be spread from one person to another, like for example COVID. It is definitely not like that. So you cannot get a breast cancer emntwini that has a breast cancer. And secondly, this is also something that is you know, if ugqoka ama-bra lawa anewaya anensimbi la ngaphansi kusho ukuthi that can cause breast cancer? No, that does not cause a breast cancer. Also, implants, they do not cause breast cancer. Deodorant, you know, that you use, mammogram, which I'll talk about it later. Caffeine, you know, having a high caffeine intake, you know, all of those things. Microwave, cell phone, these are all myths, you know, ukuthi mawubeka ifoni ebeleni ungathola breast cancer, you know, ukudla kwaseba microwave or that can cause. Please, we will explain, but those things do not cause a breast cancer. As we said, we have your environmental factors, you also have your genetic factors, and all these things together, you know, they can be present ebantwini that have a breast cancer. All right, now, okubalulekile ke kakhulu ke now is to get this cancer, lomdlavuzi, kusese early. Why? Because the earlier we detect these abnormal cells, the earlier us in the medical field we can actually intervene. But if sesithola late, kuba nzima ukuthi itreatwe, it could be in the further stages, and that can bring about difficulties. So the earlier, the better. And in fact, statistics at about 90% of patients survive for many years if this breast cancer is actually diagnosed in the early stages. And now umuntu ke mhlambe niyabuza lapha ekhaya ukuthi, okay, but how are we actually going to do this? And empeleni, we need you mbukeli emakhaya to help us in detecting this early. And I will explain ukuthi again how can you help us to detect breast cancer early emzimbeni wako. And mainly, we're going to now talk about a self-breast examination. It is a term sithola kakhulu, abanye bayazi, abanye abazi, abanye bane idea, but they're not so sure ukuthi kahle kahle how do we go about this this self-breast examination. But it helps a lot. And once you detect into abnormal, because remember, akekho umuntu owazi umzimba wakhe kangcono than umnikazi womzimba. And so what we are encouraging is the females out there, ukuthi at least, at the very least, once a month, every month, you need to do a self-breast examination. What does self-breast examination mean? You will do a breast exam on yourself. Wena uzoyenza i-breast exam on yourself. And then omunye ekhaya umbukeli uthi, mara angisuwo udokotela, mina ngikwazi lokhu. Ungakhathazeki, khululeka. Lapha ku-Holistic Healthy Living sifundisana ngani ngezempilo. And that being said, we are going to teach you ukuthi how do you do a self-breast examination. Katige babukeli amakaya, the time that you have all been waiting for, it is on. You can start, please, calling in. Siyabona abantu bayafona. The lines are open. Any question that you have, please call the number. Endingayisebenzisa ukuthi nikhulumane ngathi is 012-023-0559. The number to call ngiphinde futhi kulaba abangayibambanga, it is 012-023-0559. Now, we will actually continue. While nisafona, please call in, give us your questions, and then sifundeni ganjalo. The self-breast examination. Bese ngishilo ke ukuthi it is important ukuthi as umuntu wesifazane, you need to do it at least once a month. You need to do it on yourself. And you know, once you know how to do it, you'll find ukuthi, okay, this actually is not hard. And once you master it, it's very important ukuthi uzazi ukuthi every month I will actually be doing this examination. And if there are any abnormalities, then you can definitely go to the doctor. Why sinfundisa logo ukuthi uma uzwa ukuthi iman kunento engasi right, you immediately go to your nearest health facility, whether kusekliniki or uya kwi-GP yakho, lapho nje your nearest health facility uyaya, and then nabo they will do what we call a clinical examination. And then uma bona bathola from the clinical examination ukuthi there are indications ukuthi mele kwenziwe i-mammogram, nayo sizoyichaza later ukuthi iyini i-mammogram, then bazoyenza ke futhi kanjalo. Now let us talk about the self-breast examination. There are 3 components to it. Ngisho ukuthini mangisho njalo? So i-self-breast examination inezinto ezi-3 ekumele ukuthi sizazi, or indawo ezi-3 lapho oyenza khona. The first one is in front of the mirror. Okay? That is the first one, in front of the mirror. The second one is when you're in the shower or umugeza. That is the second place that you do your self-breast examination. And the third one is when you are lying down, umulele, on a flat surface, whether kusembedeni or kuphi. So those are the 3 places. And so umuntu makayenzile i-self-breast examination, mele uyenze this in all these places. The mirror is important, mawugeza, or when you're taking a shower, it's important, and also when you are lying down on a flat surface. All right. Now ngizonichazisela ke ukuthi kahle kahle siyenza kanjani. Please do sending a phone manje. The lines are open. It is 012-0230-559. Now let us talk about the breast examination, the self-breast examination when you are in front of the mirror. What is important? Firstly, kubalulekile ukuthi you need to be exposed, all right? Meaning, iskipa mele ukuthi sibe off, ibra mele ibe off. You need to be basically la ngaphezulu mele ube ngqunu. And then wenza njani? Uma ngaphambi kwemira, ngaphambi kwesipili, la ozozibona khona. Okay. And then the important thing is for you to observe. In front of the mirror, the main thing that you need to do is observe. Mele ubheke. What are we looking for? You are looking for any abnormalities. All right. So what you need to do is mele uphakamise izandla zakho. You raise your arms over your head. All right. And then you look for any changes emabeleni. You look for ibele eliwani elihlukile kunalele linye. Mhlambe lele liwani liphansi kakhulu ukudlula lele linye. O mhlambe eliwani livuvuke kakhulu ukudlula lele linye. Or mhlambe lele liwani lincane kakhulu or lishrinkile ukudlula lele linye. So you basically look for any abnormalities into ongayijwayelanga. Remember I said akekho umuntu owazi umzimba wakhe njengomnikazi womzimba wakhe. So you need to look for any abnormalities, features that you do not that are abnormal ebeleni lako. So you look for the skin changes. So you look at you look for any skin changes. You also look at the nipple. You also look at the nipple and the areola, and basically the nipple lilana, you know, that's where the baby latches, you know, and then you also look at the areola, the area lena etuguba darker. You look at that area, okay, and you look if there are any changes. And then also, okay, while you are looking like that, you actually want to take your hand, isandla sakho, and la ngaphakathi, you want to basically upress and you feel ukuthi, you know, are you feeling any lumps? Are you feeling is it abnormal? And babugeli, as we said, the lines are open and we will be taking a caller. Sanmonani sanamugela kwi holistic healthy living. Yes, Nompumelelo.
Ngifuna ukwazi ukuthi njengoba ngimncane, so I am 26 ne. Is it possible ukuthi nami at this age ngingayithola i-breast cancer?
That is a very important question, Siyabonga, ukuthi ke ni phone raise this question because we get it a lot. Is it possible for young people to get breast cancer? And the answer is yes. Noma ngawubani umuntu wesifazana can get a breast cancer. So ukuthi uyang akusho ukuthi cha wena angeke waze wayithola i breast cancer.
Ngiyabonga, doctor.
Thank you very much. Siyabonga kakhulu. Please stay on the show and continue listening as we answer more questions. Thank you. All right, Gunomunye Laleli Saubona, we welcome you on Holistic Healthy Living.
Hello?
Hello.
Bonjani.
Siyaphila ninjani?
Siyaphila fetshene flap.
Yes. This is GNFC Sehleleni Lwezempilo Holistic Healthy Living.
Lwezempilo hayi lacela khona imikhuleko.
Ka ilapho ke we are busy, we are teaching about health. Siyabonga. Thank you. Yebo iyo ihlelo lethu ezempilo lapho sifundisana khona ngezempilo.
Befuna la khulekelwa khona. Kuvaliwe.
Yebo mama.
Okay.
Thank you. So we're going to continue Babugeli Emakhaya, and what we are basically talking about is the self breast examination. And we said you stand in front of the mirror and you look ukuthi are there any changes, izinto ezi abnormal, izinto ezingajwayelekanga. Thereafter, you take your hand and the palm of your hand, so the middle part of your hand. And it is very important to go to sebenzisa sona, and you're just going to be, uzobu ufila ebeleni ukuthi, ka left, kuyafana yini na ka right. So whatever you do on the left-hand side, you must also do it on the right-hand side. You feel, are there any changes? Are there any hardenings? And that is what you usually do when you're in front of the mirror. Next, you need to then, when you are showering, maugeza, ne? That is when you do the second part of the self-breast examination. And what is important then, you actually want to use your fingers, your 3 middle fingers. And there are many ways that you can actually do this. But what I usually say is, utati bele and divide it into 4. Ne nali bele lonke, and you divide it into 4, and then uqala kwikhona, you start in the first block and you will start feeling, you feel we are palpate ukuthi is everything fine, yonke into right na, akuna any igaqa ongazizwisisi. Mausuga ke ku the one block, you move on to the other block. Why ngithi see divided into blocks? Because you need to be able to really palpate on akukho space ofuna ukushiya. So you start on the one block and you move on to the other block, and kanjalo until waqedile wonke lama block, and you feel and ukuthi are there any izigaqa ezikhona. And whatever you do on the left hand side, it is very important that you need to do it on the right hand side. Okay, and then you want to compare the two. If kune izinto ezifanayo, usually breast cancer, if it is on the one breast, it will be asymmetrical, meaning ngendlela kungakhona kule bele leli ne breast cancer, nangendlela kungakhona kule bele elinganayo I breast cancer, ayeke kuze kuzwakale ngokufana, ayeke kuze futhi kubonakale ngokufana. That is why it is important to say what you do on the left breast, you do it on the right breast, and you need to compare. Don't only stop ebeleni uqhubeke ufile as if uya ngasemakhwapheni. You also want to feel even in the middle of the chest. You want to feel all over la nje ku this area, and you basically want to feel, are there any things that are ungazijwayelanga ezingazwakali kahle. Now that is when you are taking a shower, and it is also important ukuthi njalo mawuyenza yaka left, isandla saka left siyaphakama, usebenzisa saka right, and then uyafila. Kanjalo mawenza yaka right, isandla saka right siyaphakama, usibeke emva kwenhloko, and then you continue palpating and you continue feeling. And then the last part of the self-breast examination, Lenage, you need to do it ulele on a flat surface. All right, so maulele gahle, that is good because then the breast tissue is spread out gahle, yabo. As opposed to maumile, there is gravity, it's pulling down. So maulele, it is nicely and evenly spread. And what you then need to do is take a pillow, and now if you are doing on the right side, you tatum kamelo, you put it under your right shoulder, And then uthatha isandla saka right futhi uyasiphakamisa, you're using your left hand, and then once again, important, divide it into blocks. All right, bhala i-cross so that uzoba nama-block ayi-4. Ulele njalo, angithi, you take your left hand because you're checking on the opposite side, and you start feeling. All right, you use your left hand, isandla, your right hand, isandla saka left isiphakamile, and then you palpate in the blocks. Or you move from one block to another, to another, to another. Ufuna ukuzwa ukuthi kuneyigaqa, is there any pain, kunento oyizwayo mhlampe ngasi right. And it is also important ukuthi mawuzwa isigaqa siyamuva, siqinile, sibhlungu, it is important ukuthi you need to also check for those things. And then what you do once again on the left, you need to do it on the right. So then you go on the right hand side, faka umcamelo nakhona, isandla saka right saphakama kanjalo, and then you use your left hand, and then you feel. Now that is what you do when you are lying down on a flat surface. Okay, why is this important? Because you need to be able to detect if there's any abnormalities, and if there's anything that makes you concerned or that raises a concern, then you need to then go and actually consult. You know what, I was doing a self-breast examination, please can you do a clinical examination on me, and thereafter we'll take it from there. This is important, as I said, babugeli emakaya ukuthi the earlier we detect the cancer, the better the prognosis for the patient, the more treatment options really we may have, because we still have time on our hands, as opposed to masses figure and then the cancer has already spread, and it is actually, there's really not much that we can do, which is why we have amahlelo that are like this, so that you can actually learn and know what you need to know, the little things that can actually save a life. All right. Now, because of iskati, babugeli emakaya, we will not be now continuing with the other things that we need to know about breast cancer. Instead, we will continue good the next week, and we're gonna explore breast cancer. But what we now need to, what we already know so far is what is cancer, and particularly what is breast cancer. We know that we do not know what are the causes. However, we do know that there are risk factors, that if you have these risk factors, it increases your chances of getting breast cancer. We also then talked about the importance of early detection of breast cancer, and LAPO, what we call self-breast examination, plays a big role, because that is where you are then able to detect ama lumps or igaqa, and it is always important to get it checked out. That being said, ukuthi umuntu abe nesigaqa or ilump akusho ukuthi une breast cancer. Kakhulu abantu baba nokusaba ukuthi yo ngizwe isigaqa, does that mean I have breast cancer? No. But once it's really isigaqa, that is very good. Go and get it checked out. Let us exclude that it is not breast cancer. Also, amanye ama signs and symptoms with breast cancer, we will get into them as we continue. But breast pain does not necessarily equal to breast cancer. Just because uzwa ipain emabeleni akusho ukuthi breast cancer. Instead, kunezinye izinto that can actually cause breast pain. And also, very important, while you are busy examining, while uzbegile in the mirror, ubege your nipple, you're looking at the areola, you also want to check ukuthi, is there any discharge? If umuntu that is not breastfeeding, it is not common ukuthi you must have a discharge in the form of milk. However, that does not mean if you have it, you have breast cancer. But what we are saying is that any discharge, anything ephumayo ebeleni, please, 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 babukeli emakaya, go and get it checked out. Ungahlali nayo uthi ngizobuka ukuthi izoyenzakalani, or uthi izozihambela, or uthi qha. Instead, you need to really go and get it checked out, because if it is breast cancer and it is in the early stages, it can always be treated. Anything, the take-home message from today is anything that is a cause for concern ebeleni lako, please go to your nearest clinic and actually get it checked out. We are kuyo i-2-part series yethu ye-breast cancer awareness, and while we are still in the month of October, kubalulekile ukuthi sikhulume ngako lokhu. And what we also mentioned is that breast cancer is not necessarily a cancer that is only seen in females. Instead, we also see it in male patients. So yes, it is very, very rare, but it is not impossible. And in fact, it is actually quite more aggressive if it is in males. Kanti ke on our side, on holistic healthy living, sithi siyabonga kakhulu babugeli emakhaya ukuthi nisjoinile, and we hope ukuthi nifundile, kanti futhi we still actually have so much more to learn about. Siyabonga ukuthi ke nisjoinile. All the comments and the questions that are on Facebook, we will definitely be attending to those. Please, on our side of a holistic healthy living, sitige ayikakabananga, and siyakhumbuzana ukuthi we are still in a pandemic. Yes, we now may be, in the country with the national level, one of the lockdown, but that doesn't mean ukuthi COVID ayiseko. That being said, it is very important ukuthi let us take the necessary precautions. Uma uhamba uya ngaphandle, please wear your mask. It is also very important that we continue to sanitize, and even more important, social distancing. Please, siyacela babugeli emakhaya, let us be safe, let us be healthy. All the unhealthy things that are in our lives, I guess it's change up, because now we know, even from today's show, those unhealthy habits can actually be risk factors for other even more serious conditions. And on our side, on holistic healthy living, siyabonga kakhulu. Let us join each other once again next week, Friday at 5 o'clock. Siyabonga.